Okay, welcome guys. I still go by the name Dr. Achievement. So today I was going through age determination. I was like, okay, let me make a video of this and share somebody. It might be useful for somebody. All right. So age determination is the topic of today. What is age determination? Before you do anything, you just ask yourself, what is this? Age determination. It is an important factor for explanation and interpretation of various body measurements. All right. Chronicle age. Chronicle age of an individual can be calculated from his or her date of birth and date of investigation. The days and months are converted into fraction of a year. And for example, you can see birth is August 25th, 1993 here. All right. So the date of investigation was done at June the 10th, 2004. All right. So August 25 equals to how many days in a year? Out of the 365 days, it is equals to 237 days. Okay, so this 237 days divided by 365 days is giving us this number 0.649. All right, so June 10th, 162 days divided by 365 days is giving us this number. And guess what we did with these numbers? Estimated age equals to 2004.44 minus this dot 44. This is June. Date of calculation is actually June 10th, 2004. So this dot 34 is coming from dot 44 is coming from this point, this 162 days. So 2004.444 minus 1993, which is the date of birth, point the 0.649. This is the figure written here. All right, so equals to 10. This figure here, 444 minus 1993.649 equals to 10 years, 795. All right, so guys, let's move further. That is for the chronologic age. Chronologic age. So now to the skeletal age. It is important to indicate it is an important indicator to assess the growth and physiological maturity. It shows the degree of development of the skeleton with the help of radiography. Each bone has a primary center of ossification, which undergoes various stages of enlargement and shaping of ossified area. Finally, it reaches the stage where this epiphyseal fusion occurs with the main body of the bone. All these changes are observed easily in a radiography, which distinguishes the ossified area from the areas of cartilage. All right, the ossified areas look opaque due to calcium content, whereas in the area of cartilage, the ossified is not yet begin. All right, the sequence of changes of shape through which each of the bone centers and epiphysis pass is constant from one person to another. Thus, the skeletal maturity or bone age of an individual is judged from the number of centers present and the stage of development for each bone. All right. What this is simply saying, or this thing is speaking, is trying to tell us that skeletal age is measured because each year, as we grow, there are changes in our skeletal bone. All right. Starting from let's use the wrist as an example, the wrist, because it's the most common measurement that was used here. So using the wrist, the baby grows, and there is some bones which you will find in an adult child you won't find in the baby at the early age. So as the baby is growing, there is some different bones you'll find when the baby is 3 years old, when you find when the baby is 7 years old, which you won't find when the baby was 0 months old or 1 month old. All right. So that is these changes. These changes are being recorded that it occurs in every individual at the same point in time. So using these changes, we'll predict that okay, right now we know when this bone is appearing and when this bone is not appearing, and we are using we are just trying to observe um, with the measurement and calculation of each year this bone is appearing. I will say, okay, now we are using this x-ray and we are knowing this age of this baby. Now, the most common method used to assess this, number one method is Greenwich Pi method. All right. In this method, a series of standard X-ray plates are formed corresponding to successive levels of skeletal maturity expressed as a skeletal age at a given chronological age. And then hand and wrist X-ray of the subject are matched as closely as possible with standard series of X-ray plates. The maturity level of each individual bone is matched to the standard X-ray in the atlas. One individual bone which matches most closely is noted. Then all the bones present in the hand and the wrist are matched with their respective standard X-ray plates and rated accordingly. The skeletal age is the median of each individually rated bones. Okay, let's move and show. Now, this is a picture of the hand. This is the hand, all right. This is the complete adult hand. You can see all the bones are there. A complete adult hand. Everything is there. All right. Most standard method show predicted and scheduled pattern of appearance, ossification and union. Okay. So sequence of ossification. First, the ossify the capitate. All right, you can see these bones first. These bones are ossifying, and next, last to ossify the sesamoid. All right. So in this, we are starting births of the from when a baby was born. If it's a female, birth to 10 months. If it's a male, birth to 14 months. You can see the X-ray of this baby. The X-ray of this baby is lacking those bones which are supposed to be here. Is lacking the complete joints in the sesamoid areas. You can see those indications that there is the baby is lacking all this. All right. For birth to 10 months for female and birth to 14 months for males. So they are lacking these crucial parts. So once the baby gets to a toddler age, sorry, excuse me. So once the baby gets to a toddler age, you can see that the part that is lacking is gradually coming up. You can see the bone, they are growing gradually. All right, you can see these areas. All right, they are growing gradually. In the toddler was like 10 months. After the baby from birth to 10 months as female, from birth to 14 months as male. So now from 10 months to 2 years for females, it's gradually coming up. From 14 months to 3 years for male, it's coming up. All right. Now see another changes from in the pre-puberty, females 2 years to 7 years, males 3 years to 9 years. So you can see, you can appreciate here, there is a very big changes in this area. You can appreciate that. All right. Coming to the puberty age, 7 years for female to 13 years, and 9 years for men to 14 years. You can see definitely that the growth of these bones are there. You can see the maturity of the bones everywhere is covering. All right. Now going to the late puberty, you can appreciate 13 years to 15 years for female, 14 years to 16 years for male. You can appreciate definitely that everything has gone so nicely and the growth has come so nicely. All right. Now going to the post puberty, you can still appreciate. So this is the first method, the first method. So let's move to the second method. You can see how they take the X-rays for the first method, the Grilic and the Pi method. You can see the X-rays which are conducted in different years. All right, to see. Now we are moving to Tanner Whitehouse method. In this method, 20 individual bones are matched for stages, through which each bone passes from initial appearance on a radiography to the mature stage. The 20 bones include 13 long bones, radius, ulnar, metacarpals, and phalanges of the first, third, and fifth digits, and seventh carpals, excluding pisiform. Each stage is assigned to a specific point score. Then the point score is summed up to give a maturity score. The sum of the score is converted to skeletal age, which is referred to as the skeletal age of the 20 bones. All right. So the next method is Tanner Whitehouse. It says in this they are collecting 20 bones, 20 individual bones. All right. So all these bones are matched in stages which each bones will pass through. All right. Sorry. So in the initial appearance on the radiograph to the mature stage, the 20 bones include 13 long bones, which include radius, ulnar, metacarpal, and phalanges. All right. So phalanges of the first metacarpal, the first phalanges, third phalanges, and the fifth phalanges, digit and seventh carpals, excluding the pisiform. All right. So this is for all the Tanner Whitehouse method. So all these stages, there is a score which has been recorded already, which has a study has already brought that. So they will just match it with the study to check to determine the age. So the Fels method, in this same method, it's similar to the Tanner Whitehouse method, but the Fels method, the Tanner White method, in this method, the same 20 bonds are similar as in the Tanner Whitehouse method, are considered along with the pisiform. In this, you use the same way you're doing the Tanner Whitehouse method, but you are including the pisiform and the adductors sesamoid. All right. So shape of individual bones and the ratios of the width of the diaphysis and corresponding epiphysis of the long bones are the basis of maturity, indicator, and specific criteria. The access grade and ratio are then entered into a microcomputer that calculates skeletal age. The dental age is the last. Alright, so the dental age can be assessed by counting the number of teeth erupted and relating this to the standard figures. So the eruption of teeth is a uniform order and a and an average age for each tooth dose substantially the same for both sexes and or races. Vast individual differences are there. So for determination of chronological age from the dental age is not absolutely but approximately. New measures of dental maturity have been suggested, which uses the stage of classification of teeth as seen in jaw X-ray. So in this dental age we are checking for the deciduous or milk dentition. All right. So we start from the lower central incisor, 6 to 9 months. We're just checking, and all this has been recorded. So we're just checking whenever this will appear if you want to check for calculation of the age. So the upper incisor, 8 to 10 months, the lower lateral incisor, and the first molar, 15 to 21 months, and the canals, 16 to 20 months, and the second molars, 20 to 24 months. So in the permanent dentition, first molar 6 years, the central incisor 7th year, lateral incisor 8th year, first premolar 9th year, second premolar 10th year, and canal 11th to 12th year, second molars 12 to 13 years, and the third molars is 17 to 25 years. So in this, with this, if you get an X-ray and you're monitoring this, you can be able to determine which year this person is falling under the category. Especially when you're calculating the age from zero, 0 months to 25 years. So if this has not come, if this third molar has not come, and you see that the third molar has not come, then you will know the person is under the category. If this has the second molar has already come, so you will know the patient or the person is under the category of 12 to 13 years. All right, guys, that is the little topic I just wanted to share today. It could be helpful for anyone out there. Thank you for watching Achievements, Dr. Achievements, and please hit the subscribe button, like, share this video. Have a very nice day, guys.